The vision is, let me save the trans community, not let me invest in the trans community. We don't need to be saved. We need to be trusted in leadership and invested in.
Welcome to the Global Public Health Revolution, the podcast by the AIDS Healthcare Foundation, where global public health meets bold advocacy and game-changing marketing to spark real change. The social wealth that is held within being able to have the privilege and honor of leading the only global trans-led organization on the planet is something that I never imagined as a young trans brown person from East LA's Boyle Heights. When the community works together and you invest in trans lives, it creates transformative change in the community. When you focus on the most underserved, you include everyone else along the way. I'll let that sink in for a bit. It's a good foundation for today's conversation and a quote from my guest, the fearless, passionate, and all-round powerhouse, Queen Victoria. How are you feeling today?
I'm feeling good. Thank you very much. I'm a little jet lag. I just got off a flight. Have a little bit of a headache. But I'm also excited because I'm here now in Mexico City working on the upcoming Transgender Economic Empowerment Forum, the only one that exists in Mexico City. We're able to get together not only 100 different corporations, but also 50 trans-led small businesses. And people might think, what does that have to do with like health? Right. Well, talking about financial health, and the quote that you just mentioned is extra poignant at this time with what's going on globally, not only in the United States, as we have the privilege at many times of leading discussions. So I'm excited and I'm ready to hit the ground running and have some meetings. I have a couple of meetings while I'm here in Mexico City to make sure that the Economic Empowerment Forum is inclusive of trans voices. Again, as you mentioned, when we focus on highlighting and providing services for the most underserved, we include everyone else along the way. And that diversity that exists in trans and non-binary community will become evident as we continue to share.
Yes, that's very impressive. Sorry about the headache, and hope that you feel better. We're not going to keep you too long on this conversation, but you've already started us off on some of the work that you do. And I'm sure our listeners want to know a bit more about you. So you're a trailblazer, a patron, and advisor of various charitable organizations, including being the president of Flux, the international president of Flux. So who is Queen Victoria and what fuels your passion and mission?
I love that question because if I were to distill down who I am, right, like the complexities of who I am, I would be describing the 3 words: woman, warrior, queen, right? I'm a woman that loves passionately both my community in Boyle Heights. I always mention that. It's where I've grown up. I've never moved. A woman who loves her work and what I've been called to do. I feel that for me, this work is a calling, and that's why I don't feel like I ever get exhausted. I do what I love to do every single day, and I'm in love with my community. The warrior part of me is that sometimes it gets messy in creating transformative change. It's not done alone. I have the privilege of working with some amazing leaders that are doing such brave work across the world, right? And that are in their warrior mode as well, where they use their righteous, and I'll say the righteous indignation to create change in spaces where sometimes things seem impossible. And the audacity of hope that lives within the human spirit is what keeps me going in that warrior mode. And the queen part allows me to understand that I have to see beyond myself, and that I believe in leadership through service, right? And you're not always at the front, but you do get to have the courageous conversations that create change with self, with and with community. And it's not always just about, I love that we use self-care and it's important, but we care. How do we look at beyond oneself? And I think when I get to work with all the amazing other queens around the world, because I don't hold it like for something that's just for myself, but that leadership is a mantle that is the mantle of leadership is taken on by choice. It's not always with the absence of fear, but courage is knowing that you are afraid, what might happen, but still knowing that the right thing is to do is much more important than our fear.
That's a good way to end that. And when I look at the woman warrior queen, I see community at the center of it. And you've spoken a lot about growing up in Boyle Heights, and even when you look around the internet about your work, you're proud of where you come from. So can you talk us through a bit in terms of what was that like for you?
Absolutely. It was, and it continues to be part of who I am. I think it represents who I am as a person because of my parents. My parents helped shape the community. My father, Prince Adrian, my mother, Queen Josephine, were Josefina in Spanish, were also part of our community. My father was involved in making sure that people had their amnesty paperwork. We translated. That's how I learned Spanish. My mother, a descendant from Chihuahua, Mexico, an immigrant to the United States, came and also built not only for herself, but for others in joining El Comité de la Esperanza, which is also dedicated to saving and preserving the apartment complex where I live, which is called Wyvenwood Garden Apartments. And if people do their homework on Wyvenwood Garden Apartments, it's been a battle to keep 2,000 families housed. And it was born in me. It is part of me. And I take that with me around the world, right? And letting people know that communities are where not only power to change things, but really power to transform things. And I will keep going back to that because for me, changing something is you change the label, and transforming something is you really having to, even at one point, break it down and rebuild it.
System.
And it reminds me of the art of kintsugi, where the Japanese art of kintsugi, where you actually can break a bowl and put it back together. And in those parts, precious metal like gold are used to make a new vessel that is functional, that is able to work for our community. And so Boyle Heights will always have a deep place in my heart. It's still my home. And so I just can't see myself being anywhere else as my home.
So when you talk about your work, you have a long history as a transgender activist, right? Fighting for equality every day. And it's no mistake that you have warrior as one of the themes that you use to define yourself. So what would you say are the biggest barriers to advancing the rights of trans and non-binary community in public health and HIV?
Well, that's a great question. I think many of the times people want to stay in the savior complex and not go into the collaborative mode. And really what we look at is, I want to feel good because I feel there's a community that needs help and needs saving. Some people refer to it as the Captain Save-A-Ho complex. But realistically, the trans community that I know is some of the strongest people on this planet. We literally are our couture selves. We have been told, no, you can't be a man, you can't be a woman, you can't be non-binary. Yet we live as we are unapologetically and so authentic to who we are that it shifts energy in the world. Like I've grown up in Boyle Heights, East LA, Mexican-American, machista community that loves and respects me. I never moved in my transition. I have been part of my community and continue to be part of my community. And that's also been the case with my career. I built it. I've created it. I created who I am. I decided what Queen Victoria would look like and being, and how me as a human being would interact and share energy with other people. And that's something that's at every human's reach. But I see trans community having it as part of who we are. and our legacy being creation. And so that with that power of creation comes the responsibility of how you will use that. Will you create or will you destroy?
So we're not just talking about the labels now. We're trying to upend the systems or turn it upside down in a way that it becomes more equitable for everyone. And even with communities, we know that at the heart of public health, it is the people that matter, right? It's the people that count every day. And so I'm just wondering, with everything that's happening now in the world, with even issues around funding for health and the policies sometimes that also have been put in place to work against access to health, how do these barriers affect, trans-led work at the grassroots level and the outreaches that are needed?
I'm going to weave the previous question to this one. And one is like, what is affecting? And one is the lack of investment in trans leadership. I will boil it down to that.
Okay.
One, because the vision is, let me save the trans community, not let me invest in the trans community. We don't need to be saved. We need to be trusted in leadership and invested in. And the second component is the impact that it has is that it negates the world of the inheritance that we had that I've referenced, which is creation. We've never lived inside a box. We have lived in our critical thinking cap since day one, because I've had to survive being told, no, you're in the wrong body, you're in the wrong gender, you're deficient, you don't belong, to be present. Just the what it takes me to show up every single day and not want to, off myself, is so intentional and so authentic and so pure that if people saw what that investment would be, it would change the world. And I think that that's one of the things that people lack the vision to see, but also the impact that it robs the world of folks that already think outside the box. I've never been in a box. I wasn't meant to be ordinary. I was meant to be extraordinary. And so therefore, why not invest in people who already think outside the box? When systems are not working, were never created for us to be part of. That's what we live every day. Imagine being able to tap into that resource, that way of thinking of how do you find a solution, right? Because we definitely have had problems, but we definitely find our own solution and we create them in order for us to exist and not just exist, but go beyond, even being a victim to thriving. And that's what I continue to see.
And thank you for sharing that, because I also look at when you talk about the savior complex, it's also the fact that the community needs to be trusted. So the community has the lived experience and it should be trusted to design its own solutions. And that's what we're talking about now, even in global health. So when you look at either marginalized communities or underserved communities, it is the fact that most of the interventions are made to seem like it is to save them. And no one is asking their opinion, their thoughts on designing programs or interventions that speak to their needs and their lived reality. So I do like the fact that you're putting the focus on investing in trans leadership. Because when we talk about health, most times we talk about the issue of access, right? We talk about affordability, which are all important. We talk about the discrimination that happens. But the leadership is also key, because when you have more leaders, then you have the ability to increase representation, decision making, and all of those things that come with rebuilding the system. So I want to connect it to your work with Flux. So again, it speaks to your leadership, because Flux is an international organization. And maybe for the benefit of those who don't know, if you could just share a bit about Flux and how the work that you're doing across countries is also helping to address some of these barriers that you're encountering every step of the way.
Absolutely. So our mission at Flux is that we raise the profile of trans community through creating events, safe spaces, and innovative advocacy initiatives. You don't see in our mission, that's our mission, and you don't see in our mission doing direct services, because the focus is on that, on creating those spaces for leaders that we already know have the capability. If you're able to not only survive, but thrive under immense amount of pressure, it's like the adage of a diamond shines the brightest where you cut it, And we've been through it. We've been through the pressure. We've been cut. We've been polished. We've been forged in the fire. It's finding those leaders and investing in their leadership and in their vision that allows us to create those safe spaces and have the innovative advocacy. So it doesn't take something that's convoluted and complicated. It's just as simple as build it and they will come. And we've created spaces where would get leaders that never would have met just to meet. And when you have the people who are the chingones and chingonas, which is badasses, get together, badass stuff happens, right? And so we've seen that kind of be the catalyst, and we see ourselves as Flux being the catalyst for communities that have already existed, but might have been in survival phase and haven't had the intentional conversation of how do you thrive and how do we see our diversity as a plus. So our mission is to create those spaces that are events that let people connect at a human level. It's not that's the magic, right? Is people connecting as humans, and then from there, people that are connecting as humans that care create things that matter, and that's the equation. Also, Flux happens to be a division of AIDS Healthcare Foundation that has invested in 5 different populations, including Impulse that focuses on the gay community, Spark that focuses on women, Black that focuses on Black community, Somos Loud that focuses on Latino community, and then Flux that focuses on trans community. So all of them are, and I would be remiss in not, mentioning my affinity brothers, because that's what we're about, is creating together. And the one group that is cross-sectional is the trans community. Because if you notice, most of them are both based on sexual orientation or race.
Yeah.
And Flux, we have, I don't stop being a Latina because I'm trans. I'm actually a trans Latina. My sister, Queen Shayla, who co-leads with me and is the vice president, is, a Black trans American woman who lives from that experience. So we see our diversity and cross-sectionality and intersectionality as a absolute strength.
You bring in the layers to it. So I'm just thinking now, how do you use Flux as a vehicle towards health for the trans and non-binary community? And if there's anyone listening who is interested, how can they be part of Flux?
Well, the way that we address health is that we look at it holistically. So one of the things is that health is not separate from your environment, right? Looking at the place that you're at, really taking into context, do you have access to housing? Do you have access to food? Addressing Maslow's hierarchy of need. Do you have access to education, which, is a key to liberation, is knowledge. And then applied knowledge is power. So are these factors that are in your life, and in addition to financial health? For me personally, in 2005, I helped create the first ever transgender economic empowerment initiative that was focused on creating a job fair at first. It was a simple job fair. And then at that time, there was only 3 of us working in LA County that were in nonprofits of trans experience. Now I can say that the market is saturated. It lit fire throughout the United States. And now we have
and that's a good
many
thing.
people working. Many people working in the nonprofit sector, but we're not done, right? There's financial literacy, and now there's wealth management. I'm glad to say that we are in that phase where I'm proud. I'm a proud business owner, and I know many Flux members are business owners as well. And we're looking at holistically, as I mentioned, do you have access to home, food, education? The possibility of thinking, do you want to be a business owner or do you want to work for somebody? Is there financial literacy and wealth management as intentional discussions? So if people want that, if people are seeking to be part of a group that creates events, that create community, that bring people together, that care, that create things that matter, and change and transform their community, please look up your local Flux chapter, because you will find a group of people that think that way, that are solution-based thinkers, right? So it's amazing to see. To me, it's a blessing, not only amazing, to see my community be there for each other. right? Especially at this time, to have a sense of belonging is something that oftentimes is robbed from our narrative, both in our culture, as for example, speaking as a Latina woman, that I'm not supposed to exist. As from the spiritual sense, it's robbed from us. From
Yeah.
societal aspect, it's robbed from us, and only certain pieces are allowed to exist. Whether it's for trans women being only sex workers and hairstylists, which is not a bad gig, their work, their work as well. The multifaceted richness that exists in our diversity is allowed to exist. It's allowed to be invested in Flux. And if people have a dream, I like to say that my job and the job of every Flux leader, because I work with leaders, right, is to make sure that people's dreams come true. Right, that we are co-collaborators, and co-developers in making people's dreams come true. And that's why we continue to thrive, because we have a endless engine of people who are thinking outside the box, who are thinking of how do I create the next thing that's going to impact my whole health, not just one facet of it, because that's going to matter, right? How you feel, how you belong. And being now 30 years in HIV prevention and treatment, I always thought, like, what is the missing part? And it's a sense of positive future self. If you know that the future is bright, that you are going to be happy, that you have something to contribute, that your community and your chosen family or family are going to love you, you take whatever precautions you need to, and you do whatever you need to in the present to be in that future. And that's one of the things that I think is wonderful about being able to create those spaces with community.
I like that you referenced the issue of spaces. And what I'm hearing, even as you speak, is the humanizing part of health. Because sometimes we leave that part out. So the bit about the community, the safe spaces, those are all very key. And now it's making me think, because on this podcast, we've had the honor of having diverse voices, from young people to focus on men or even leaders, and now bringing in the focus on trans power. And I'm just wondering, how do you harness your community and structures to be able to address things like stigma that is still prevalent, even within the community, and whether it has to do even with services? How do you harness that to address stigma?
I think part of it is taking Marsha P. Johnson's word, the P in Marsha P. Johnson's name, who is one of our mothers of the movement, is pay it no mind, right? And paying that no mind, meaning like in the sense that stigma is going to exist. We could either give it that fuel and fire that it needs to live in, that negativity that it needs to live in, or we can decide to open up our hearts, our lives into people. And I think that that's what changes things, right? That human connection. When I stopped being the trans Latina from East LA label, which is definitely something of my identity, but when I just start being your friend, your neighbor, your coworker, and you're able to see me without the titles, or people are able to see us without the titles, it's what shifts things, right? And that's when stigma dies, is when you confront stigma with the humanity and the connection. Because although I belong to this group that can be labeled as a special interest group, I'm a person. We've all experienced stigma. We've all experienced not being picked for the football team, the kickball team, the baseball team, the swim team, the track team. We've all been discriminated because of the color of our skin, the way our eyes are shaped, or the texture of our hair. We've all heard something that was meant to put us down and to stigmatize us. That is the human experience. And when we start seeing that we've all felt that, and we don't want to inflict that on another human being, it shifts thinking. And I think it's building, we address stigma by building common ground and building human connection. That's the only way you can extinguish it and abate it, is by making sure that people see the human and not the title or not the label that has been given.
So I want us to look a bit at, again, we've talked about Flux. So it's been 10 years. So congratulations. Flux just celebrated its decade of of empowerment and services. But at the same time, you also wear another hat, which is with the Connie Norman Empowerment Center. So it's been 10 years of Flux and 5 years of the Connie Norman Empowerment Center. Can you just share about these initiatives? I know you've spoken about Flux a bit, so we could also look at the Connie Norman Center and how they are critical in centering trans and non-binary community voices, representation, and community action. So
I have the privilege of leading Flux and looking at the Connie Norman Trans Empowerment Center. My title there is the Chief Visionary Officer. And so how that came about is that it was serendipitous, right? It was like, well, a third party was looking for a building. And then I was asked to show up at an address and was like presented with 20,000 square foot space, like, ta-da! And as I mentioned, a lot of things in my life have been serendipitous that way, on mistake, but on purpose. Sometimes I feel that your higher power leads you in a direction that you should have found for yourself. And I was hesitant because I started my consulting company and I was like, how am I going to take on, the responsibility of a transgender empowerment center? And even in the naming of it, it was intentional. It was making sure that it was hard for people to wrap their head around of coming to an empowerment center and not a service center. And so the concept behind it was to create a WeWork space, an incubator for trans-led nonprofits that were desiring to get their feet off the ground, to stand on their own 2 feet and create institutions, were welcomed, and that they were not the traditional sense. Like we house the Transgender Chorus of Los Angeles, which the funniest question that I always get around the Trans Chorus of Los Angeles, what do? They sing.
They sing.
They sing. They're a chorus. Who have done marvelous, wonderful things, even singing at the inauguration of Joe Biden. We also house Unique Women's Coalition because Unique Women's Coalition is the only Black trans-led organization in Southern California, right? There wasn't any other organization like it. We also house Flux Studios, which is an actual full running studio where the partner tenants, and we do call them partner tenants, where unique point of refuge, which is housing for elder trans women, is also available, where trans can work, the only workforce development and the largest workforce development focused institution for trans community is housed also at the Transgender Empowerment Center. So it's really a gathering of trans-led organizations that are thinking again of how do you find a solution that's outside the box. And we're all in one space. We have a large community room called the Marsha P. Johnson and Sylvia Rivera Community Room. We have the Lou Sullivan Conference Room, named after the trans masculine HIV positive leader who contributed to our community. The Kelly Trumbaco Conference Room, which was the first African-American trans woman to start a workforce development program out of Minority AIDS Project. And she knew that economy and economic empowerment had an impact on your health. So this is where the walls get to hear, and to get a little bit emotional in a good way, it's like the walls get to hear history. We create history. Yeah, we are the only, and we say, I know that people say me, but I think the magic is that it's not alone.
Yeah.
It's never meant to be.
Yeah.
It's what makes the load lighter, right? You don't have to be. When you have people who love you, and when you're able to accept, I am worthy of love, I'm worthy of belonging, it changes things. It's funny because I'm still struggling with the fact that I have emotions. I've been becoming comfortable as I get older also with being able to express emotion. But the one thing that I hope, not that I hope, that I know that we've worked collectively for in Flux and at Conotech is that people come away knowing they belong.
Yeah.
That they are seen.
Yeah.
Yeah. then we did our job.
Yeah,
Yes.
and thank you for sharing, because it is important, this conversation we're having, not just for the trans and non-binary community, but for public health, but for the world at large. These are conversations that we should and must be having. And I just want to find out from you, looking at what the trans empowerment, the Connie Norman Trans Empowerment Center does, and with all these trans-led organizations finding a space within that safety wall for them. What is the feedback you're getting in terms of the impact? How is it shaping their lives and transforming their entire, work?
Well, I mean, the feedback I'm getting is evident in how busy we are, in the sense of creating events. Right? We have at least 2 or 3 events per week where people are coming to either receive services. We're launching the clinic now. It took 4 years for us to get to a point where we could actually launch a clinic, which we're having our hard launch date on March 14th. And people feel that it's a place where they come and exactly live what's on the building. They feel empowered, right? How we measure that is that we also have a survey that we do and that we continue to do to gauge where we're at. And what we've been hearing back is that they don't never pictured or dreamed in their wildest dreams walking in a building that you see the word transgender. There's a trans flag outside. We're also the only first voting polling place in the entire United States in a trans space. You could come vote. You could come use your voice for advocacy. You could use your voice to sing. You can use the space to ideate and create the future nonprofit that you want to create. And you could come get healthcare.
Yeah.
So I mean, the feedback that we're getting and that we continue to get is oftentimes humbling. It's humbling in that people don't want to leave. We don't kick people out, but people don't want to leave. People feel at home.
At home, yeah.
And that's the thing that we probably hear the most is I feel at home. I feel like I have a home.
Going back to the power of community and something you just said, which is they feel seen. Because that's also important when we talk about well-being, we talk about healthcare, it's to be seen. Because when you are seen, then you are met where you are, right? And,
Absolutely.
And the services you receive or the support you get is not just prescribed. It speaks to you and your realities and someone understanding, not just trying to save you. Like what we talked about, the savior complex. I think that's also what sometimes people tend to miss. Even we've talked about even in healthcare settings, how sometimes healthcare providers do not engage with clients or patients based off of the need, but it's more of, well, this is what I have to do. I think that speaks to the issue of being patient-centered. So it's not just within the healthcare setting, but even in spaces of community and power like this, it's making sure that people are seen and then they can contribute, right? And I think this is, since we're talking about Connie, who she was famously known as the AIDS diva. There's a quote I have, an excerpt from a quote that she made here that I'd like to build on. And I think it also aligns with what you're saying. And she said, it reads, "I am simply a human being seeking my humanity. I am simply a human being seeking my humanity." What can the world and the public health sector learn from this quote concerning, honoring humanity as very key for achieving true equality or even improving health outcomes for trans and binary and non-binary communities, please?
Well, I think that what people can learn from the quote of Connie Norman is the magnitude of impact and the future vision that she had. She lived with such determination and really spoke about issues before her time. I didn't have the privilege of meeting her, but I always say that I'm haunted by Connie Norman, only because I didn't even know who she was when I received an essay award called the Connie Advocacy Award. This was before, I even worked with Flux. This was, I think, in the early 2000s. And I was like, well, who's this lady? And I left it at that. And then here comes the Connie Norman Center. And then I started my TV show called Royalty, finding out that she did a radio show. She did a broadcast cable show as well. We live very similar lives that we lived fully and passionately. And when I think about that quote, it's complete Connie, right? She cut through the bullshit. And I think that that's what made her the AIDS diva, is that she cut through the bullshit and got to the point of seeing people's heart and humanity. And if you see her TV show, her radio show, her interactions when she was in her activist warrior mode, it was who she was. It was raw, it was passionate, and it was how she lived her life is, getting to that human part, getting to that human aspect is what changes things. And I think that it behooves us to learn that lesson and to live it out. Right? How do we become those humans searching for our humanity? Because that is the journey of life. And in that journey of life is that's how we discover who we are and why we are here.
So how do you keep the fire burning? And how do you stay calm with everything happening?
I love my chosen family. I get to work alongside my chosen family. Having them not only be with me in implementing Flux and the Connie Norman Trans Empowerment Center is the greatest gift and blessing. I found my purpose at 17. I knew what I was meant to do, right? I took an oath of service and leadership when I became queen, and know the gravity and of impact of intention. And that's how I keep it burning, because I'm not alone in doing so. And even in that covenant, as I like to say, in doing the work.
Now, how do you stay calm?
Staying calm doesn't always happen. Just gonna be honest. There's still a Latina from Boyle Heights living up in here, and she comes out. So I don't think you can stay calm all the time. It's not always the time. It's not always, Queen Victoria, the other Queen Victoria, the other plus size woman is across that died 150 years ago, and that culture saying, keep calm and carry on. Sometimes, you cannot be calm. Sometimes it takes the fire. Sometimes it takes the fight. And I'm okay with that. I have those parts of me that make me who I am, and that also make my community and the people and the leaders I work with effective. We're not always calm. We come from a place of rebellion. We're, history makers and cycle breakers. And I embrace that. So sometimes it's not about being calm. Sometimes it's about taking action. And it's not always nice. Sometimes it can be harsh. But at the end of the day, it is necessary for transformation to happen.
Absolutely. Yeah. We need disruptors at the end of the day. We need advocates and activists. Otherwise, we'll never get most of the things that we have, even on the path to fighting for justice and equality. Good trouble is needed every now and then. Okay. So I want us to look a bit, but first, before I go to that, I just want to say thank you and the entire team at Flux and the Connie Norman Trans Empowerment Center for the incredible, life-changing work you continue to do, making sure that equality can be achieved, because it is possible, that everyone is carried along and no one is left behind. So I want to thank you for the work you do in creating the spaces and the community for connection, for support. I feel it's important to say that before I go into this next point, because now we're moving away a bit, now looking at your work as a leader, but how that can also be beneficial for those who are coming behind you, or even those who look up to you right now. So imagine that you are standing in a room filled with the next generation of trans and non-binary leaders. Again, when you take into account the intersectionalities that exist, and then they're looking to you for a way forward, what will be your message of inspiration to them for their health and as they navigate a world that is very exclusionary and discriminatory?
Well, it's a pleasure and a privilege that I do not have to imagine it. I was in that room just a few weeks ago when we celebrated our 10-year anniversary. We had the amazing ability and support to be able to have our international retreat, which brought all the cultures from across the world from all our chapters. And what I told them is, look within. When the outside is crumbling and the sky is falling and, the threat of destruction is at the door, is look within. Don't forget where we came from. Don't forget who you are. Don't ever betray your values and what you stand for. And as long as you do that, you will always be living in purpose. You will be coming from a place of meaning. And so I had the ability to say that to them. And how are they going to create that into the world? How are they going to bring that into the world? And it is looking within and staying true to oneself, not forgetting who we come from and letting it be the impulse of how we move forward. So that's what I would say to trans leaders. And I love the fact that we actually have succession planning built into Flux, right? I am just a steward, and Queen Shayla and everybody else that are part of Flux United are mentors to the rest of the leaders in each of the chapters. Everyone's assigned a chapter. It comes from our tribal community, right? Where we took in all the people that were turned out from homes in the house scene here in the United States. But it's not only a U.S. thing, it's a global thing that trans and non-binary people found a home, brought other LGBT kids and youth to live with us and raise them as our chosen family. So we have the privilege of doing the same with more resources. And so why not use them? Why not dream big and in color? And so we're going to do that.
And we will be standing right beside you and cheering you on as you continue to do that. Thank you very, very much, Queen Victoria. So now there's a fun side to this. And that is the part where we get to ask you some fun questions. But this conversation we've just had, like, I felt it in my bone. I felt it in my soul. And I'm hoping that our listeners feel the same way, because it takes all of us, to come together to change the system. I really enjoyed this conversation that we've had today. And we hope that it sparks something even more amongst our listeners, but also within the sector, the public health sector, and even in the fight against HIV/AIDS as well. So this fun part is just some fun questions for you. And I also have a question from a fan of yours, a huge fan of yours. But that will be the last question. So I'll start first with our normal questions around, so we call it, this isn't necessarily a rapid fire for this episode, but you don't have to think about it too much. The first question that comes to your mind, or if you need to think about it a little bit, that's okay too. So are you ready?
Yeah.
All right. So what is the one power song that picks you up and makes you feel invisible no matter where you are?
Jennifer Lopez, Let's Get Loud.
Oh, I like that one. Let's get loud. I like that one. That's good. And then if you had to pick one signature fashion accessory that defines your queen energy, what is it?
My pearl necklace.
Ooh, clutching those pearls.
Yes.
So do you get to clutch them from time to time?
Oh, absolutely. All the time.
Okay, great. Then if you could have dinner with any three people, now live-in or, who are you inviting?
I think I would definitely want to have dinner with Queen Elizabeth II, Jennifer Lopez, and the third would be Jacqueline Kennedy. Those would be the three women.
That's a powerhouse group. Is there a particular reason for each of them?
Well, one, because I admire Queen Elizabeth II's commitment to leadership and her ability to adapt. in times, and never complain, never explain. You do the job, and it's for life. Jennifer Lopez, the amount of self-belief, right? Some people get mad at her, and is a Latina, one of the Latina women that I think, if we really think about it, there isn't any other Latina as close as she is to be the first billionaire Latina in the United States. And what she's done with just her empire, and just because I used to also, when I was very, very, very thin back in the days, I used to impersonate her. So that's one of the reasons I would like to sit with her. I just look up to her in that way. And the third being Jacqueline Kennedy, because she's been a fashion reference for me. But it to me, it was also interesting that she got to be in places of historical reference. And it was with this kind of quiet elegance that people did notice. And she had this way of kind of owning a room with quiet power. And I admire that.
So if you could have one literal superpower to help you in your advocacy work, what would that be?
That they would never tell me no. That it was always a yes.
Yeah, that's a good one. And that's yes. Very needed for advocacy. All right. So when the Queen is off duty, what's your favorite way to relax and unplug?
Oh, shopping. I know it seems so superficial, but I derive, if anybody's ever seen the movie Shopaholic, there's a scene where she describes the peace and the smell of shopping. Really settles me. Anytime I'm stressed or anything, if I listen to Let's Get Loud and go shopping, even if it's window shopping, it makes me feel a sense of calm.
It's a retail therapy there. That's why they call it retail therapy.
Yes.
When you talked about the smell, and it reminds me of how I am when I walk into a bookstore. Just the smell of the books. Some people don't understand it.
I mean, I was meant to live a luxurious life, and I like the smell of luxury. So therefore, I put myself in that space so that I remind myself what it smells like and what it's like to experience beautiful things.
Couldn't be more regal. All right, then. So if you had a billboard in the middle of the city and you could only put 3 words on it, what would they say?
Can I do 4?
Okay, do 4. Yeah, let's do 4.
Don't be an asshole.
For 3 words, I was actually going to go with woman, warrior, queen.
That's the nice version.
But we'll take that.
But my dark humor one is don't be an asshole. I think when we remind people to not do that, they act differently. You'll be surprised how many times that shifted the energy in the room from you. It's like, I don't care who you are, where you come from. I care if you're an asshole. That's it.
Yeah.
So don't be one.
It adds an element of shock value, which always works. Okay, so a huge fan of your work wants to know, what's your best makeup tip for staying flawless?
What's my best makeup tip? Is joy. If you find the joy in life, you can be wearing tons of makeup. You could wear not a stitch of makeup. Joy looks good on everyone.
Joy looks good on everyone. That's a good and a high note to end this episode. Joy looks good on everyone. Thank you so much, Queen Victoria, for being our guest on today. And you have left a lot of powerful gems that we can use in our work in public health, but it's also highlighting the importance of centering trans and non-binary community, even in health, but it's also the power of community. The power of community, the power of connection, the power of humanity. So thank you so much for coming with us on this very ride today. And hopefully when we call on you next time, you'll show up.
Of course, I'm here. Thank you for having me.
Thank you so much.
Thanks for being part of the global public health revolution. We hope today's conversation left you inspired, challenged, and ready to shake things up. If you loved this episode, don't keep it to yourself. Subscribe, leave us a review, and share it with your network. Let's keep the momentum going.
Resonate.